Hello everyone, my name is Yadelaimi Barbera and today I will be discussing about ulcerative colitis. Patient information and patient history. A 64 years old male. The patient presented with complaints of diarrhea for a week with blood in stool and no clots formed. The diarrhea is also accompanied with abdominal pain. Over the last 2 days, the patient noted mucus and pus in the stool. The symptoms are accompanied by fatigue and loss of appetite and fever. Patient did a KUB X-ray followed by a barium enema and then was referred for a colonoscopy with biopsy. The patient is experiencing discomfort in the abdominal area, which the technologist needs to be aware of to avoid causing further discomfort or damage to the patient. The patient should know he can alert the technologist of pain or discomfort at any time during the procedure. Interaction with the patient. First, you will start introducing yourself as the technologist doing the procedure. You will ask basic information like name, date of birth, what's the procedure they're doing, if they know what procedure they're doing. Ask them also if they have any prior surgery on the area we're going to be doing the procedure, any history for the patient so we can fill it out and give that information to the radiologist. If the patient doesn't know what exam they're doing, you will explain how the procedure works, what to expect, what to do during and after the procedure. In this case, for the barium enema, since it's a very uncomfortable exam, we will have to let the patient know that they will have introduced on their rectum a tip. It will be uncomfortable. They need to follow our directions. I will tell them that I will be with them throughout the entire procedure. I wouldn't leave them alone. Then also, if they have any questions, I will ask their questions. I need to make them feel comfortable during and after the procedure, even though it's an uncomfortable exam, but just so they know they're not alone. Then assist them at all times. When the exam is over, help them out to the bathroom so they can go clean themselves, change. And then once they're done with the exam, then I will accompany them to where their relatives are waiting for them. KUB X-ray studies, which means kidneys, ureter, and bladder. A kidney, ureter, and bladder KUB study is an X-ray study that allows your doctor to access the organs of your urinary and gastrointestinal system. Doctors order a KUB study to identify abdominal pain that they haven't diagnosed yet. During the test, X-ray images are taken of the structures of your digestive system, including the intestines and stomach. The KUB procedure can help your doctor diagnose certain gastrointestinal conditions. We have here a radiographic X-ray of a KUB. We have on the right upper quadrant of the patient, the liver, and there we have the right kidney. Then we have the ascending colon. Then on the left upper quadrant of the patient, we have the spleen. Then we have the left kidney under the spleen, and behind the kidney we have the stomach. Then we can see the line of the sole's muscles. Then we see the descending colon. Then following the small intestine and the rectum. BE X-ray studies, which is a barium enema, is an X-ray examination of the colon. When the lower gastrointestinal tract is filled with barium, the radiologist is able to view and access the anatomy and function. Here we have a picture where you can see how the patient is laying down on the bed, and then it's done through fluoroscopy. We can see the back of the barium, then we see the tube. Then here we have a picture where it shows the large intestine, and then we can see the tube that was inserted inside the rectum of the patient. And you can see a little bit of the barium going up the large intestine. And then on the right side, you can see the same image, but how it will look on an X-ray filled out with barium. The large intestine filled out with barium. Before doing a barium enema, patients need to follow some protocols. 24 hours before the test, they should take laxative and liquid diet to clear the colon. Second, once they are doing the procedure at the X-ray department, they will lubricate the enema tube and place it in the rectum. Then the mixture of barium sulfate and water fills the colon. Then X-rays are taken for about 15 to 20 minutes. Once the X-rays are done, barium solution is drained through the tube. Now we have here a radiographic picture of the X-ray taken while doing the barium enema, and which is done, once I said before, it's done through fluoroscopy. So here on the right side of the patient, we have the cecum labeled, we have the ascending column, then the hepatic flexure, then the transverse column, the splenic flexure, descending colon, sigmoid colon, the rectum, and the anal canal. For the KUB and the barium enema, we have to have some consideration with the technical factors. For the KUB, I will use an 80 kVp and 20 MAS. On the KUB, it will demonstrate the outline of liver, spleen, soles, muscles, and kidneys to include symphysis pubis, lower abdomen, and diaphragm. Optimal density and contrast to visualize soles, muscle, and lumbar transverse processes. Air fluid levels seen if present, and liver margins and kidneys visible on patients of average size. For barium enema, I will use an RAO or LAO position. The KVP, I will use, if it's a single contrast, 110 kVp to 125. If it's double contrast, 90 kVp to 110. And if it's water-soluble contrast, I will use 80 kVp and 80 kVp to 90 kVp. MAS, I will keep it at 20 as well. Or it depends on, as I said, the contrast I will be using. Now, for an LPO or RAO, it will demonstrate the right colic flexure and ascending and sigmoid colon. For an RPO and LAO, it will show left colic flexure and descending colon. Appropriate technique to visualize mucosa without overexposing other structures. On this slide, we have a summary of the radiologist report for my 64-year-old male that was diagnosed with ulcerative colitis. The patient, aside from doing the barium enema with the KUB, also had to do some laboratories. After the radiologist analyzed the x-rays and the labs, he was referred to do a colonoscopy with biopsy. Now, the colonoscopy results were that endoscopic evidence of ulcerative colitis, diffuse erythematous inflammation up to the splenic flexure. Now, the initial treatment for this patient was with a mesalamine oral and a suppository, which the patient had to take the medication as oral in the mornings and then the suppositories at night. What is ulcerative colitis? The ulcerative colitis is an inflammatory bowel disease that causes long-lasting inflammation and ulcers of the inner lining of the colon and rectum. Symptoms such as pain and bloody stool usually develop over time rather than suddenly. Ulcerative colitis can be debilitating and can sometimes lead to life-threatening complications. Even though it is an idiopathic disease, a number of reasons can contribute to colitis, which includes infections caused by bacteria, viruses, or parasites, inflammatory bowel disease, such as ulcerative colitis or Crohn's disease. Allergic reaction, ischemic colitis, and microscopic colitis. Also, it could make the patient lose weight or loss of appetite. On this slide, we have two radiographic images that shows how the ulcerative colitis is detected. On the left side, we have a frontal plane radiograph of the abdomen that demonstrates a narrow, fissureless colon delineated with gas with lack of haustral markings, giving the lead pipe sign in ulcerative colitis. You can see it in the arrows. It's pointing here in the arrows. On the right side, it's barium enema, which demonstrates barium delineating a narrow, fissureless colon with lack of haustral markings, giving the lead pipe sign with tiny filling defects, pseudopolyps, and granular mucosa. There is no cure for ulcerative colitis, but with treatment, you can find symptoms relief and even prevent symptoms entirely for years at a time. Treatment for ulcerative colitis can include medicine, changes in your diet, or surgery. Doctors may suggest several types of medicines to curb inflammation in the patient's bowel, including sulfa drugs, corticosteroids, immunosuppressive agents, and antibiotics. While food doesn't appear to play a role in causing ulcerative colitis, certain foods may cause more symptoms when the disease is active. Doctors may suggest diet changes depending on patient symptoms. These treatments won't cure your ulcerative colitis unless you have surgery that removes the colon and rectum, which is considered curative, but they can help ease your symptoms. Even though there's no cure, there's still hope for the patient if they are treated and they follow all the protocols and take their medicines or even the IVs. It depends on the medicine that they are given. They can live with it, and it doesn't have to cause them to get more aggressive and end up on a cancer. How to detect ulcerative colitis. Ulcerative colitis is diagnosed by performing a colonoscopy with biopsy. But before a patient is referred to do a colonoscopy with biopsy, the patient must do blood tests. A complete blood count can reveal whether you are anemic or low in certain minerals, both possibly side effects of diarrhea. Levels of C-reactive protein measure the extent of inflammation in the body. X-rays such as barium enema can detect an intestinal blockage or narrowing of the intestine. CT scans are used to check for complications such as abscess or fistulas. And other imaging testing such as upper gastrointestinal series, sigmoidoscopy, upper endoscopy, MR enterography, or capsule tests to visualize the small bowel may also be used during the process of diagnosing ulcerative colitis. What is a colonoscopy? A colonoscopy is an exam used to detect changes or abnormalities in the large intestine and rectum. During a colonoscopy, a long flexible tube is inserted into the rectum. A tiny video camera at the tip of the tube allows the doctor to view the inside of the entire colon. If necessary, polyps or other types of abnormal tissues can be removed through the scope during a colonoscopy and is sent to the lab for further studies. Ulcerative colitis appearance on a colonoscopy. A typical colonoscopic image from patients with fulminant ulcerative colitis is what I'm showing here. The colonoscopy photographs showing extensive and deep ulcers together with near total loss of the mucosal layer, typically seen in patients with fulminant ulcerative colitis. This condition is debilitating. Patients may suffer from weight loss and impaired quality of life. They often must opt for surgery when it gets to this point. In conclusion, Ulcerative colitis is an inflammatory bowel disease that causes long-lasting inflammation and ulcer in your digestive tract, affecting the innermost lining of your large intestine and rectum. Symptoms such as pain and bloody stool usually develop over time, rather than suddenly. Even though it is an idiopathic disease, a number of reasons can contribute to colitis. Ulcerative colitis is diagnosed by performing a colonoscopy with biopsy. Other imaging tests, such as X-ray, may also be used during the process of diagnosing ulcerative colitis. There is no way to cure ulcerative colitis, but with treatment, you can find symptoms relief and even prevent symptoms entirely for years at a time. And this is all for today, guys. I hope you learned something today. And if you know any family member or any friend that might have this condition, please just be supportive and give them hope that even though it won't be cured, but they can live with it and they will improve their quality of life. Thank you and have a wonderful day.